and we expect we'll be peaking very soon. The other point to make before we get into this is, peaking is important, but when you're on the other side of the mountain, you can still be awfully high up off the ground, which is where we are now. We're going in the right direction. I'm rather confident that the worst of this particular surge is behind us, but cases are going to be really high in Louisiana for the next few weeks. There's still going to be a lot of transmission. It's going to take a few weeks to get back down to a more normal state. So peaking is good. I think it's, I'm optimistic and I'm thankful, but there still is going to be a lot of COVID being spread from person to person over the next few weeks. There still is going to be a lot of risk, even though we're very thankful that we're going in the right direction. What you see on the screen here is our incidence graph. This is the number of new cases of COVID diagnosed each day, smoothed out over a 7-day average. You can see right off the bat that this surge, this Omicron surge, and again, 99% of every new case of COVID, both nationally and in this region of the country, is due to Omicron, is than at points prior. You do see that we've peaked. It's now been about 7 days since we've been going in the downward direction on a statewide average, which is good. This past week, we had on average 1,500 new cases of COVID per 100,000 residents over a week period. That's down from just over 1,800 the week prior. So we are very, very thankful for that. The rate of new cases is over 100 new cases per 100,000 residents per week in all 64 parishes. And that's the bar the CDC sets for the highest possible category of risk of community transmission. So in all 64 parishes, as has been the case for a few weeks now, transmission is as highest as the CDC has categories for. The risk of getting COVID, the risk of being exposed to COVID is as high as the CDC classification rating goes in all 64 parishes in the state. This is a national graph. This was pulled from a report the CDC put out this week. So it's national data. It runs through just through after the first or second week of January of this year, and it goes back to December of 2020. It shows cases over that time, which is the solid blue line. It shows ER visits for COVID, which is the thicker dotted line. It shows, give me 1 second, plug in my computer so it doesn't die on me here. It shows COVID hospitalizations, which is the smaller dotted line. And then on the very bottom, it shows COVID-related deaths. I wanted to make a couple points on this graph. Number one, it looks like nationwide, we are peaking as well. You see the solid blue line, the case line, begin to kind of round the bend up there. You see the larger blue dotted line, the one for ER visits, having already peaked and come down. I'll note that's a trend that we saw here too, where our metric for ER visits, COVID-like illness, which is similar but not precisely the same as this graph, has peaked a couple of weeks before our cases peaked. That's all encouraging. The hospitalizations line, which is the smaller of the two dotted lines there, is the highest that it's been in the country at any point prior in the pandemic. This is an interesting comparison with Louisiana because our Delta surge, this was the one in July and August of this past year for us, for Louisiana, that was the highest hospitalization point we had got to. We peaked out at 3,022 hospitalized patients in that Delta surge in July and August. And I don't think, thankfully, I don't think we're going to get to that point during this surge. We're at just over 2,000 patients now, and we're on the downtrend. So I don't think we're going to reach our Delta peak. It's interesting to me that nationwide, the peak for hospitalizations here is higher than it was in Delta nationwide. For Louisiana, that's not the case. I'll tell you, I attribute that to the relatively low vaccination status in Louisiana. Nationwide, we're behind the average for vaccination status. We certainly were that case during Delta. That made us particularly more vulnerable in that Delta surge. So when I look at this graph, the first thing that I really take in from it is we had excess mortality in that Delta surge than we had to compared to national averages because we weren't as vaccinated as other states were. This is the last slide that I'll talk on before I hand it over to Theresa. This is the typical, we call it the gating criteria slide, but we look at this slide every time that we talk about our COVID stats. And I'll run through these 4 graphs very quickly. On the top left, you see COVID-like illness. This is the percentage of ER visits that are attributable to COVID-like symptoms. You see we have been going down for a few weeks now. We're at 8.8% of all ER visits now are people coming in for symptoms that could be COVID. That's down from 11.5% the week prior. And as we just noted, this particular trend peaked and turned about a week or two before overall cases peaked and turned. And that's a trend that took place nationally as well. On the top right, you see the incidence graph that we just went over. It's been going down, thankfully, for the past 7 days in Louisiana. On the bottom left, you see the combination graph. The purple line is testing volume. How many tests are being conducted in Louisiana? We continue to do a ton of testing during this surge in Louisiana. This past week, 473 tests per 10,000 residents over a week's time. That's down a little bit from the week prior, but still just about as high as it was at any point prior in the pandemic. It's about as high as it was at the peak of our Delta surge. A lot of tests. Were considerably over 1 million tests conducted just in the month of January. So a very high volume testing month for us for obvious reasons. A lot of exposures, a lot of people getting symptomatic. On the bottom, you see the orange bar graph. That's percent positivity. Thankfully, we have gone down a little bit in percent positivity this week as well. Last week, 27.5% of tests were positive in the state. That's down to 27.3%. On the bottom right, you see COVID positive hospitalizations. So the number of people who are in hospital beds admitted at this point in time in Louisiana who are COVID positive. Today we went down 23 from the day prior. We're now at 2,187 hospitalized COVID patients. I expect that to go down slowly over the next few days. Of those 2,187 individuals, 181 of them are on mechanical ventilators that have very severe disease. That number, unfortunately, is up 18 from the day prior. Of everyone who's currently COVID positive in a hospital bed today in Louisiana, 73% of them are not fully vaccinated, meaning they haven't had their 1 J&J or 2 Pfizer and Moderna shots. 93% of everyone COVID positive in a hospital bed in Louisiana today is not boosted. So what we have learned through Omicron is a booster shot really is necessary to give adequate protection. If you just have the primary series, 1 J&J or 2 Pfizer and Moderna, your protection is less against Omicron than it was against Delta and the prior variants. If you get a booster, that raises your protection about to the level it would have been had you not been boosted but fully vaccinated against prior variants. Being boosted is so very important against the Omicron variant. I'm going to pause there and I'm going to hand it over to Theresa to walk through a few more slides. Theresa?
Thanks, Dr. Kanter. Can everybody hear me?
Yeah, we got you good.
So what I'm going to do, as Dr. Kanter mentioned, different parts of the state are at different stages in this surge in terms of transmission. So I'm going to quickly review every region of the state. I'm going to talk about these 4 indicators that Dr. Kanter overviewed. I'm going to go, since he gave an explanation of each, and since I think a lot of you are already familiar with what they are, I'm not going to go through an explanation, and I'm going to just go in the same order that he did, top left, top right, bottom left, bottom right. So we will start with Region 1, the greater New Orleans area. There we have COVID-like illness at 6.3% of all emergency department visits. Region 1 is where we are seeing the steepest decline in average daily incidence. We are down to 105 per 100,000 per day as of the most recent reporting period. Keep in mind the high was more than 300 per 100,000 today, but 105 per 100,000 is still extremely high. Keep in mind that based on CDC thresholds, 100 per 100,000 per week is considered to be the highest level of transmission, and the New Orleans area is still seeing that level of transmission per day. And actually, it's still slightly above the Delta peak in terms of average daily incidence. But according to the CDC calculation that we use, CDC methodology we use for defining a downward trajectory, the New Orleans area has been in a downward trajectory 14 days, and that's really defined by the negative slope. Percent positivity is down from 23.3% last week to 18.1% this week. And that's actually despite a sharp drop in testing. Usually we expect to see the opposite. When we see a sharp drop in testing, we're going to see a sort of a commensurate increase in percent positivity. But despite that, we're still seeing quite a substantial drop in percent positivity, which is a good sign. And hospitalizations are decreasing over the last 14 days. Next slide, please. So here we're looking at Region 2, the Baton Rouge area. COVID-like illness represents 5.2% of all emergency department visits in the Baton Rouge area. Baton Rouge also has declining average day incidence and 9 days in a downward trajectory. Their most recent average daily incidence is 175 per 100,000, so quite a bit higher than the New Orleans area and extremely high level of transmission. Percent positivity also decreased in Region 2. Down from 30% to 27.8%. There was a slight drop in test volume, but the test volume here you can see is still higher than any previous point during the surge, so, during any of the previous surges, I should say. Hospitalizations here are also decreasing over the last 14 days. Next slide, please. This is Region 3, South Central Louisiana. COVID-like illness here is 9.5% of all emergency department visits, so quite a bit higher than you're seeing in Regions 1 and Region 2, but this area is seeing a declining average daily incidence, has 5 days in a downward trajectory, and looking at 156 per 100,000 average daily incidence most recently. Percent positivity appears to essentially be stable. It's 29.5% this week. It was 30.2% last week, and we've seen a little bit of a drop in test volume there as well. Here, hospitalizations appear to have increased very slightly over the last 14 days. Next slide, please. Region 4, Acadiana. Now, what you'll see is the next three regions, Regions 4, 5, and 6, really show a very similar pattern. You're going to see fairly much the same trends across all of these regions. CLI in Region 4 is 8.7%. If you look at the most recent average daily incidence, it's a decline from what they've seen at the highest point in the peak so far, but we're not officially in a downward trajectory yet. We're not seeing a negative slope. And they're having a most recent average daily incidence of 159 per 100,000. Here, the percent positivity is increasing. It increased from 25.2 to 26.4. It's one of 5 regions that have seen an increase in percent positivity from last week to this week. Hospitalizations are down just slightly. You'll still see an increasing 14-day trend, but most recently they're down slightly from the peak that they experienced on January 20th. Region 5, the Lake Charles area. CLI there is 10.5% of all emergency department visits. Average daily incidence, again, is most recently down from the peak, but not yet in downward trajectory. And their average daily incidence is 175 per 100,000. Percent positivity also increased from 28.3% to 30%. And there was a slight drop in test volume, but again, in Region 5, what we're seeing is still a higher test volume than we've seen in previous surges. Similar to Region 4, hospitalizations appear to be down slightly from their peak on January 20th. So if you look at the 14-day trend, you will see that positive slope. Region 6, Central Louisiana. CLI there is at 8.5%. Average daily incidence is 161 per 100,000, down a little bit from the peak, but still not in that decreasing slope. Percent positivity also increased here from 22.9 to 24.4%. And in Region 6, we actually did see a fairly sharp drop in test volume over the most recent week. Hospitalizations in Region 6, again, they appear to have peaked on January 20th, and they're down from that peak over the most recent several days. Region 7, the Shreveport area, has the lowest CLI in the state, 4.88%, but their percent positivity did increase from 31.6% last week to 34.2% this week, and they also experienced a sharp drop in test volume. Average daily incidence here is declining. They have 4 days in a downward trajectory, but it is still extremely high. It's 191 per 100,000. Again, average daily incidence. Hospitalization down from their peak, and also was on January 20th, but still higher than during any other surge. Region 8, Monroe. The CLI in the Monroe area is 9.71%. Average daily incidence hasn't made much downward movement from the peak, and they actually have the highest average daily incidence in the state right now. That's 219 per 100,000. Their percent positivity also increased from 28.9 to 30.5, and hospitalizations are clearly continuing to increase in Region 8. Region 9, the North Shore. Region 9 has the highest CLI in the state, 11.13%. Average daily incidence, again, hasn't made much downward progress from their peak. It's still very high at 187 per 100,000. Percent positivity increased quite a bit in Region 9 from 31.7 to 37.2. This is the highest in the state, the highest percent positivity in the state, and it's the highest the percent positivity has ever been in this region. Hospitalizations are increasing over 14 days, but most recently appear to be stable. Next slide, please. So this is our community risk map. I think most folks are familiar with it. Everybody knows that it's determined by 1 week incidence and 1 week percent positivity, and either a percent positivity higher than 10% or a 1 week incidence greater than 100 per 100,000 is considered to be the highest level of transmission. This is according to CDC thresholds that have been established. Our current statewide 1 week incidence is 1,500 per 100,000. And this is still nearly double. This is down from last week, which was 1,800 per 100,000, but it's still nearly double our peak 1 week incidence during Delta, which was about 770 per 100,000. And our current statewide percent positivity is still exceptionally high. It's 27.3%. And despite the fact that we now appear in general to be heading in the right direction, we clearly are still experiencing widespread transmission. Next slide, please. This is our cases by age group slide, which everyone is well familiar with. As you can see, new cases are trending downward across all age groups. Children less than 18 still account for the highest proportion of new cases. That age group is represented by the orange line right here. Well, it's on my screen, but by the orange line that you see that's at the top. And really the 5 to 17-year-olds are driving the numbers in the pediatric population. They're much higher than the 0 to 4 age group. As far as our schools are concerned, almost 8,000 cases were reported among K through 12 students by schools last week. This is, again, one of the 2 highest weeks that we've ever had reported by far. And this is in the context of the fact that a lot of schools are not able to report simply because they have so many cases that the contact tracing and the isolation and the quarantine are taking up a lot of activities, are taking up a lot of their time. So we know that the 8,000 cases represents an underestimate of the number of cases that have actually occurred in the K through 12 student population. Unfortunately, both on a national level and in Louisiana, we're seeing an increase in COVID hospitalizations among all pediatric age groups, but the highest among these is the 0 to 4 age group. We do have a system whereby hospitals report directly to the infectious disease epidemiology section within the Office of Public Health, pediatric hospitalizations, and from those data, we can see that hospitalizations reported among children 0 to 4 years of age this month so far have already exceeded the month during Delta that had the highest peak hospitalizations for that age group. So it's really quite a few hospitalizations in that age group. Because those less than 5, they're medically vulnerable and they can't get the vaccine. It's important for the rest of us to get the vaccine ourselves and also to wear masks, because these are really the ways that we have to protect these vulnerable kids. Next slide, please. So I have a couple of slides where I want to talk about reinfections. You can see the numbers that we've reported today, 944 total statewide since yesterday, and cumulative total of 54,000, just over 54,000 reinfections. Just to make sure everybody knows, a reinfection is a positive test result in an individual that previously tested positive at least 90 days prior. Starting yesterday, reinfections are now included in our regional and parish counts. When we first started reporting out, we only reported out statewide totals, but now those reinfections are included in the regional and parish counts. We've gotten a lot of questions about that. Just a little bit of extra information for folks that might be curious. The average time frame we have between the first infection and a new reinfection is about a year. I want to let everybody know that the total reinfections do include third and fourth infections. So as long as there is a 90-day time period between positive test results, we will count people multiple times. I just want to make sure that everybody is aware of that. Of course, by far, the majority of our infections, of our reinfections, are just second infections. We have more than 50,000 of those. And then we have maybe between 700 and 800 third reinfections, and then just a very handful of fourth infections. Next slide, please. So I wanted to show this graph just to highlight the dramatic increase in the number of reinfections during the Omicron surge. And this is really because Omicron has an increased ability to evade infection from natural immunity and to evade immunity from natural infection, and because of the high level of transmission that we're seeing. Overall, I know this number was reported last week, 66% of reinfections occurred among people who were not fully vaccinated, and 83% of COVID-associated reinfection deaths occurred among people who were not fully vaccinated. So this really just drives home the point that people who've been previously infected are not well protected from another infection or from severe illness and death, and so it's really important that they get vaccinated and boosted. Next slide, please. So I'm very happy to be able to present this information because there have been a lot of questions and a lot of concerns from folks about the potential impact of the COVID vaccine on fertility for women of childbearing age. And there have been a few smaller studies that have demonstrated that there was no connection. But this is a large landmark preconception study. It's a prospective cohort study. It was funded by the National Institute of Health, and it's really administered by the Boston University School of Public Health. And the scientists there, they enrolled over 2,100 women that lived either in the US or Canada. They enrolled them between December of 2020 and September of 2021 and followed them then through November of 2021. So their male partners were also invited to participate, and both were asked to complete a survey every 8 weeks until they became pregnant, or a full 12 months if they didn't become pregnant. And the survey included questions about lifestyle and medical factors, but it also included questions about vaccination status and previous COVID infection. So then, of course, the scientists calculated sort of probability of conception among vaccinated versus unvaccinated, and they also looked at previous infection and the impact on fertility. So what did they find? Basically, just overall, 73% of the participants in this study received at least one dose of the COVID vaccine, and 7% of people reported a positive COVID-19 infection. So here are the important findings. Female vaccination did not have an impact on conception. In the unvaccinated, the 1 vaccine dose and the 2 vaccine dose groups, basically between 18 and 19% of all of those groups resulted in pregnancies. Male vaccination did not have an impact on conception. If you look again, the 3 groups, unvaccinated, 1 vaccinated with 1 dose, vaccinated with 2 doses. Between 16 and 18% across all of those groups resulted in pregnancies. Female infection also did not have an impact on conception. However, interestingly, male infection from SARS-CoV-2 didn't have an overall impact on conception, but it did have an impact on conception in the short term. So males who tested positive within 60 days were 18% less likely to conceive during that cycle. And this is really consistent with previous research that showed that COVID-19 infections sort of temporarily impact male fertility, and it's really related to sperm quality, decreased concentration, lower motility. Again, it didn't have an overall impact in the long term, but it did appear to support some previous findings that had a short-term impact. Next slide, please. So this is the last slide, and I did want to talk just a little bit about flu. So on a national level, this graph demonstrates Louisiana data, but nationally, flu activity has decreased. It remains elevated. In Louisiana, you can see the current season is shown by the purple line with the purple triangle. Flu activity also decreased during the most recent weekly reporting period. It's really right at our regional baseline there. We do expect that flu activity, while it's difficult to predict, it's going to continue for at least a few to several more weeks. I will say that the majority of influenza viruses detected both in Louisiana and nationally are influenza A, H3N2. And H3N2 predominant seasons have typically been associated with more severe seasons, and that's particularly among older adults and young children. Some preliminary data do suggest that the vaccine effectiveness against the currently circulating H3N2 viruses may be reduced this season, and we evaluate that, CDC evaluates that and reports that out. However, vaccine is still going to offer protection against severe illness and death. So it's definitely worthwhile to get the flu vaccine. And speaking, unfortunately, of severe illnesses and severe outcomes, I do want to let everyone know that there have been a total of 5 influenza-associated pediatric deaths that have been reported nationwide so far during this 2021-22 season. One of those influenza-associated pediatric deaths did come from Louisiana. And since 2006, when we started reporting pediatric flu deaths, 94% of all of those pediatric flu deaths reported in Louisiana have occurred among children who have not been vaccinated against flu. And flu is one where we really want to encourage higher uptake of the vaccine. Just so you know, among those 0 to 17 years of age, only less than 12.5% of those children have been vaccinated so far this season against the flu. Among adults who are 18 and above, that's 16.4%. So I know quite a few folks who've gone and gotten their booster along with the flu vaccine. It's not too late. I still strongly encourage people to do so. And I think that is the last slide, Dr. Kanter.
Great. Thanks so much, Theresa. I second that encouragement. It's not too late to get your flu vaccine. I mean, we've had flu seasons where we've dipped a little bit and then picked back up afterwards. So I would strongly recommend people, if you haven't gotten your flu vax, still benefit to doing so. We were spared really